Hi, my name is Kathleen Kobashi, and I'm one of the urologists here at Houston Methodist Hospital. Urinary incontinence is a very common problem that affects many people across the United States. The definition of urinary incontinence is the involuntary loss of urine, which can be quite embarrassing and a real quality of life problem for many people. The most common types of urinary leakage, amongst many, are stress urinary incontinence and urgency incontinence, which is overactive bladder. It's usually a problem with the valve muscle. So if you think of the bladder to be like a balloon, where the neck of the bladder is or where the knot would be, if the knot's not tight enough and somebody squeezes the balloon, it can cause some leakage. So if you cough or sneeze or jump or do exercise, that pressure overcomes what the valve can tolerate and it leaks. The most common reasons why people develop stress urinary incontinence in women is vaginal delivery of babies, but it can also be time and gravity and some hormone changes and just life, or lifestyle with heavy lifting and straining and a lot of running. For men, it's most commonly because of prostate surgery after prostate cancer surgery, and the reason for that is that the prostate, when it's removed, is located right next to the valve muscle. So when we remove the prostate, sometimes it can affect the strength of the valve muscle. The other kind of leakage is called overactive bladder or urgency incontinence. And basically, it's just like it sounds. It's when you feel like you gotta go right now. And sometimes you just can't quite make it in time. That's a problem actually with the balloon. So the balloon is squeezing when it's not supposed to, or the balloon is really stiff, or it's just that the balloon is more sensitive, the bladder is more sensitive, so it feels like it has to go at a lower volume than it should. The most common reasons why people get overactive bladder for women are going to be lack of estrogen in the vagina and dietary irritants, just like caffeine or a glass of wine. And for men also, when the prostate enlarges, with or without prostate cancer, so this can be benign growth of the prostate. Since the prostate is like a donut around the tube that you urinate through, if the donut gets bigger, the hole gets smaller. And what happens is that the bladder compensates by getting overactive. And when that happens, over time, patients get overactive bladder. So if there's problems emptying the bladder or with a slow stream due to the prostate, we also want to get that addressed so you don't develop overactive bladder.